As Vice Chairman of the Legislature's Public Health Committee, what have you done to address the opioid crisis and high overdose rates we've seen in Connecticut and in our area, and what more needs to be done?
Sure, certainly. Thank you for the question. As the Vice Chair of the Public Health Committee, this year we made historic legislation in requiring that doctors only prescribe prescription drugs up to 7 days. Normally it was a 30-day subscription, and now we've limited to a 7-day subscription, and we think that will help certainly reduce the attempts or the ability for someone to become so addicted to a strong painkiller. The opioid fight is something that's multifaceted. There certainly needs to be more in the realm of treatment and possibly behavioral treatment, so that individuals with a certain type of behavior may be more susceptible to becoming addicted, and if they are, then we can get them the treatment that they need.
Mr. Dempsky, if your views on what might be done to address this crisis we've seen in our area and across the country.
Well, first, thanks for the opportunity. I think this is a great idea, and I hope that it works out. I'd like to start off with the legislation that Representative Riley just mentioned. I think that that's a great step to take. 7 days as opposed to 30 not only helps control the addiction level for the individual patient, but a lot of times, I'm sure that we all know through conversation, et cetera, somebody is prescribed a medication, they don't use all of it, it's extra, where does it go? Well, sometimes, unfortunately, that medication gets sold, and that gets out into the market and contributes to the problem. So I think that that's another ancillary benefit to that legislation. So I think that that's great. I think that another very helpful way to determine how we're going to attack this problem is to look at what has worked in other states. I'll probably come back to this point several times, the whole concept of federalism and states' rights. When states have strong governments and are able to govern themselves without a lot of federal government restrictions, they're able to come up with innovative solutions to problems that present themselves. Now, this opioid addiction in general, with aside from what had happened in past years in Willimantic, really hasn't been a national attention story, but this is becoming one, and it's something that we as a state don't necessarily have a ton of experience in dealing with. So I think that using other states is a valuable resource, and that's something that we should certainly do, and try to make the best decisions available with our limited budgetary options that are going to be available to us, with coming into $170 billion shortfall, $170 million shortfall. Those options are going to be, questionable at best. So finding ways to get the most bang for our buck, so to speak, will be key in dealing with the issue.
And Ms. Hong.
Yes. I think the legislation that was passed was a good first step, but the problem is that there's still a real big push to use opiates in general for pain control. They are addicting. From personal experience, I know that over the last several months, I've been placed on codeine, morphine, oxycodone, all of which I basically tried not to take, because for the prolonged period of pain that I happen to have shingles, so the prolonged period of pain would have made me addicted to any one of those three, had I taken them the way they were being prescribed. The fact that the medical marijuana restrictions for pain control in the state of Connecticut are so narrow, to me is one concern, and I think that definitely has to be expanded. There is really good pain control using medical marijuana that's been proven, so I think that really has to be looked at carefully. Also, the treatment facilities for current addicts are well underfunded. There are many agencies that work on it, but most of them are underfunded, and I would like to kind of look at more of the treatment facilities and their success rates. But I think the last My last point, very quickly, would be what Rob made in talking about the fact that when, and particularly parents maybe have an issue where they were prescribed an opiate, they haven't used all of it. The fact that Norwich does have medication drop box at our police station is really critical, and I think most people don't recognize that it's right there. I think that when the doctors should be more aware that that is an available drop-off point, so that medications can be removed from the home by the family, given to their family doctors.
Thank you. Before we move on to another question, just following up on that, a couple of points are raised, starting with Representative Riley. When your opponents talked about balancing, at least one of your opponents talked about the cost of these expanded programs. If we need more beds, if we need more services, that costs money. So if you could maybe address that conundrum of the state's budget problem, weighed against the need to perhaps provide more services in this regard, and whether you think liberalizing the medical uses of marijuana is something that the state should consider. And Representative Riley.
So that's two parts to that question.
Right.
In the first part, government is available to provide services, and I think we as a state legislature are trying to provide the best services we can with the amount of money in the revenue that we have to provide those services. Is there a need for more beds in the detox facilities such as SCAD here in New London? I believe there is. At some points there are times when those beds are empty. I'd worked at SCAD for about 6 years, so I'm very acute and very knowledgeable about the situation that is at hand. There are times when those beds are not full. So there is a wave of back and forth between the need for the bed and the ability to provide the bed. If there is a chance, or if there is the ability for the legislature to provide more beds and provide more treatment, I believe that as a whole the General Assembly will. As far as the medical marijuana and the expansion of the treatment use for medical marijuana, I'm in full support of that. We have just expanded it to, I believe, about 17 different afflictions that an individual can have that they can use medical marijuana. And this year we were proud to do it as well for children, and having parents as guardian or a guardian be able to administer the marijuana to a child as well.
And any further comment from Mr. Dempsky?
Yeah, one thing that I forgot to mention is, we talk about the addiction, and sure, some people unfortunately get addicted because they've been prescribed drugs. Other people are out seeking, that opioid high, and for those people who become addicted through that route, I think that we have to ask the question: why are they choosing to do that? Why are they making that choice to start taking these drugs and to become addicted? And one of the reasons that you can point to is jobs. I think that it's not necessarily coincidental that that this addiction problem is really strongly manifesting in a time when the job situation in the state and the overall economy has trended the way that it has. So I think that we can do a lot to help ourselves in that regard by turning the economy of the state around and creating an environment that's more conducive to businesses flourishing and prospering and creating those jobs, so that people have better choices to make rather than to seek out these highs. So.
And kind of last word, your opinion on medical marijuana. Have you supported it, and would you consider expanding it if indeed you support?
Yeah, the research that I've done, on my own has shown that medical marijuana in specific cases for specific diseases and afflictions can be very helpful. And most recently, I've read that it has. There are studies that show that has an effect in actually helping to bring people off of opioid addiction. So that's coming at it from a different angle than Ms. Hong had mentioned, but I think it's important to point out nonetheless. So that could be an additional use that the legislature could look at permitting, rather than methadone, using the cannabinoids to help people come off of and detox from the heroin and opioid addiction.
And if you have something further, I want to give you kind of last chance.
Just to expand on what he just said, it is by empirical information, not by blind studies. Physicians will tell you that it has helped many addicted patients once they've started on medical marijuana. It has absolutely reduced the amount that they needed initially, and I've had a number of previous addicts actually speak to me about how it was because they were able to get on the medical marijuana that they were able to get off of their opiates. But I think that I would expand, I personally, because I absolutely do believe that the prohibition against marijuana is it's unfounded. Certainly it is not a Class 1 drug, but I think that also adding to our budget, if marijuana were just legalized in the state, it would have some impact on our budget revenues. Having spoken to several of the marijuana dispensaries, they would find it a very easy transition to go from just dispensing medical marijuana and dispensing legalized marijuana, collecting the tax revenues from that, because there are no tax revenues to the state for any medical marijuana. So I think just as a budgetary I look at our budget and how marijuana legalized in the state could also have an impact.
We actually had that on a list of questions, but since it came up, we might as well get everyone on the record now.